Florida has been slowly stepping back from vaccine mandates, and now we just heard this week that they're going to be pushing to remove all vaccine mandates.
All of them. All of them.
From schools in terms of children's requirements in schools to get vaccinated.
Who am I to tell you what your child should put in your body?
And Florida would really be the first state to take that extreme measure in the country. The biggest concern with removing mandated vaccines is that it's going to create a lot of confusion for doctors, for parents, potentially increase outbreaks that we see in those communities where the mandates have been removed, and also leave vulnerable the population of those that can't get vaccinated, like those who are elderly or immunocompromised or the really young. We know historically, we know that the science hasn't changed, that when you take backward steps in terms of lowering that level of herd immunity in the group, in the community, you will see outbreaks and resurgences of diseases. The concern is not only may we see resurgence of things like measles, which we've already been seeing in the last several years, but possibly even diseases that we don't really see much anymore, like polio, for example. Or if we let our guard down, are we going to see new viruses and diseases crop up and be really unprepared because we haven't invested in the science to really protect ourselves? Clearly, the policies at this point seem like we're headed in a direction where we may see a fractured approach with different states doing different things. We've heard that the Northwest is forming an alliance to create what pathway they're going to take when it comes to vaccination. The Northeast is doing something similar. Florida's obviously stepping back. So we may see this patchwork approach to vaccination, but the concern is that germs and viruses, they don't know state borders. And so we can put all the rules we want in place, but that's not how infectious disease works. And while vaccines are extremely effective, there can be breakthrough infections. They're not perfect. And so even though you may try to protect your community, people can still be vulnerable if they come in contact with those who are unvaccinated. There's no question that public trust is at an all-time low. We started to see a decline during COVID, and now we're really at a tough point. I think an inflection point where we have two directions to go. And it seems like right now, there really isn't a lot of faith in who is driving the ship, who is leading these decisions, and Americans really don't know where to go. I mean, it used to be you would go to the CDC and review the evidence that they had reviewed and make a pathway and a plan from that, and now that has come into question. The best message we can all give at this point is to speak to your particular doctor. Sit down and have a conversation with your doctor about what you should do, where the evidence is at this point, what their best recommendations are. That trusted relationship that you have with your physician is going to be the best resource right now, I think, until we find the direction that we're heading in.